Welcome everyone. So now we are going to look at the pneumonia. Pneumonia is infection of lung parenchyma, and it causes cough or fever or chills, tachycardia, tachypnea, dyspnea, pleuritic chest pain, and respiratory distress. And there are different causative agents of pneumonia. So for diagnosis of pneumonia, there are physical examination and blood test with sputum culture can be performed to look at the infection and its type. Treatment of pneumonia is with antibiotics or antiviral. It depends upon the etiology. If it is fungal origin, then antifungal agents can also help in treatment of pneumonia. So prevention is also there are vaccines for pneumonia, and we are going to look at the three types of pneumonia. Now, when we look at the type of pneumonia, that is community acquired pneumonia, hospital acquired pneumonia, ventilator associated pneumonia, aspiration pneumonia, atypical pneumonia, viral fungal pneumonia. So these are different types of pneumonia. Community acquired pneumonia occurs outside of the healthcare setting, while hospital acquired pneumonia occurs when patient is hospitalized for 48 hours. It can happen into the hospital. And ventilator associated pneumonia is type of pneumonia that occurs more than 48 hours after endotracheal intubation or mechanical ventilation. So it happens with ventilator, that's why called ventilator acquired pneumonia. Aspiration pneumonia occurs when inhalation of any food particle or vomiting into the lung, then aspiration pneumonia happens. Atypical pneumonia occurs when there is mycoplasma pneumonia or chlamydophila pneumonia. Legionella can cause bacterial infection. So in this way, atypical pneumonia happens, and viral pneumonia occurs because of respiratory syncytial virus or adenovirus. And the final fungal pneumonia happens because of patient have immunocompromised histoplasma or cryptococcus neoform can cause fungal pneumonia. So these are different. Okay, so look at the mnemonic for severity of pneumonia and community acquired pneumonia. We use mnemonic CRB 65. So C stands for confusion in new onset, R stands for respiratory rate is more than 30, blood pressure is less than 90, and age is greater than 65. So a 65-year-old patient complain with respiratory difficulty with shortness of breath, cough, septa, and chest tightness, having blood pressure less than 90. Patient is confused. What will be the diagnosis? That may be community acquired pneumonia. So this is mnemonic carb 65 in order to look at the severity of community acquired pneumonia. So in this mnemonic carb 65, we look the patient and treat the patient according to the score. If patient has a score 0 to 1, then treat the patient and treat as outpatient. In 2 to 3, consider short stay in hospital. In 4 and 5 score required hospitalization. There is another mnemonic for community acquired pneumonia assessment, that is curb 65. Confusion, urea is raised more than 7, respiratory rate is raised, blood pressure is less than 90, and age is more than 65.